and also with the advice of the National Emergency Response Committee to COVID-19 and the National Security Council, today again I issue Public Order number 4 of 2021. And that is number 1, that the hours of curfew are maintained at between 7 p.m. and 4 a.m. in the COVID-19 hotspots which comprise the counties of Kisumu, Siaya, Homa Bay, Migori, Busia, Kakamega, Vihiga, Bungoma, Kisii, Nyamira, Kericho, Bomet, and Trans Nzoia up to the 31st of July 2021. That for the rest of the territory of the Republic of Kenya, the nationwide curfew shall continue to be observed from 10 p.m. to 4 a.m. for a further containment period of 60 days. That excluding the above-mentioned counties, in-person worship and congregational worship shall continue to be conducted in keeping with the one-third capacity rule and in accordance with the guidelines of the Interfaith Council. That the prohibition against public gatherings is extended for a further 60 days. That all persons coming into the country must be in possession of a negative COVID-19 PCR certificate acquired no more than 96 hours prior to arrival into the country, with the PCR certificate also having been validated by the trusted travel platform for those traveling by air. That duly classified and licensed hospitality establishments must continue to adhere to the guidelines issued by the Ministry of Health. The establishments must also ensure the adoption of and compliance with the tourism safe travels protocols developed by the hospitality sector themselves. In regards to funerals, cremations, and other interment ceremonies, it is directed that these ceremonies shall be conducted strictly within the 96 hours of confirmation of death. That the attendees, officiators, and facilitators of funerals or graveside cremation ceremonies shall be limited to 100 persons in total. That the attendees, officiators, and facilitators of wedding celebrations, of marriage or traditional union ceremonies or rites of passage, and all other similar events or ceremonies shall be limited to 100 persons in total. That all hospitals are directed to limit the number of visitors for hospitalized patients to 1 visitor per patient per day, and that all other rules, guidelines, and protocols not reviewed through this public order shall continue to apply until otherwise notified.